All right, let's get ready. We're going to talk about toenail fungus. If you're a podiatrist, if you're a family doctor, or you're a patient, inevitably you've heard about toenail fungus, you've come in contact with it, you've seen it, you've tried to treat it. You're going to want to watch this. I'm Dr. Nick, and I'm going to tell you how I treat toenail fungus. Or is it even toenail fungus? Or is it just deformed toenails? Well, let's start with what's happening to these toenails when they end up this way. It's probably one of the most boring and most frustrating things that I treat in my office. We see a lot of complicated pathology, a lot of complicated foot conditions, deformed toes, fractures, serious infections, and inevitably these patients always end up asking, I have a toenail that's yellow and thick. What can you do to fix it? Well, it depends. So let's start with, is it really a fungus that causes this? It could be. There is evidence that fungus does grow in the nail plate, but remember, fungus grows in a warm, dark, moist environment, which is our shoe gear, right? Our feet are in shoes with socks. We sweat, it's dark, it's warm, and that's where fungus grows. So you can culture the toenail and it could grow fungus. If that's the case, the scientific evidence recommends treating it with an antifungal known as terbinafine, or you may have heard it called Lamisil. And this is a pill that you take. A lot of patients say, I'm not taking that pill because it's harmful or it's detrimental to my liver, my kidneys. It is excreted through those organs, but it's a safe medication to take as long as we take those precautions and doing a proper history and physical, making sure you don't have any pre-existing problems with your liver or your kidneys, and that you're not on any other medications, specifically anticoagulants like Coumadin. And the newer recommendation is we actually pulse dose Lamisil. So you're only taking the medication, you're taking 2 pills a day for 7 days, and then you stop it for 3 weeks, and then you go back on it for a week, and you do this for a total of 4 months. So that's the oral medication to treat it. Then there's a topical medication called cyclopyrox. This is an antifungal nail solution. It's actually a lacquer similar to toenail polish, and you'll paint it on the toenails once a day for 7 days. After 7 days, you file it off, you clean it off with alcohol, and then you start it again. And you're going to do this for a total of 6 months because it takes that long for a toenail to grow out. So if you've tried these 2 antifungal solutions and it's failed, what's the next step? Well, one, it may not be fungus. It may just be damage. The number one reason we see thick, yellow, deformed toenails is due to damage. If you've ever dropped something on your toe and the toenail falls off and then it grows back deformed, that's an example. Deformed toenails resulting from trauma. So if you're taking these antifungal medications and it's not working, it's most likely permanent damage. And I tell my patients, it's really a cosmetic problem. It's not a systemic illness where that fungus is going to spread from your toenail and get into your bloodstream and cause a severe infection. Now, could that occur? It is extremely rare. We sometimes see toenail fungus and we'll see an associated athlete's foot infection or fungus on the skin, but it's rare given the number of times we see these deformed toenails. So if the topical medication has failed, the Lamisil antifungal oral medication has failed, the next option that I offer my patients is to temporarily remove the toenail, and then we'll paint the nail bed with an antifungal cream as the nail plate is growing back, and in 6 to 9 months, you'll know if it works. This is effective. In my anecdotal experience in treating it this way, I've seen much better results than treating it orally. So I'll remove the toenail temporarily, treat it with an antifungal cream, give it 6 to 9 months, the toenail does grow back, and then we see if it's clear. Now, if this fails, then pretty much the only option is to permanently remove the nail. And we'll do the same type of procedure. We take the nail plate off, but we're going to put a chemical on there, and that chemical creates a chemical burn and it stops the nail plate from growing back. So that's the final option when you just can't get that deformed toenail to clear up. So which option is best for you? How do you know what to do? Well, the literature shows that if it's only about 20% infected, or there's only 20% change or damage to the toenail, then those patients will respond most effectively to the antifungal agents, both the oral medication and the topical. If that's not working and there's no other option, then I would recommend the removal, treating it with the cream, or permanent removal. That's it. That's how I treat toenail infections. If you have any questions, drop it in the comment section below. I'd love to respond to your questions. I hope this helps. See you in the next video.